Hi, everyone. Welcome to the Oregon Immunization Program's training on immunization law in Oregon schools and children's facilities. This training is about immunization reports. My name is Stacy Diasis Matthews. You can email our team at oregon.imm@odhsoha.oregon.gov if you have questions that come up during the training, or if you'd like to request this training in a different format. Let's get started. This is a series of trainings that covers the immunization review process in 3 parts: records, alert IIS, and requirements. This training is about reports. Let's go over some important due dates first. The primary review summary, also known as PRS, pages 1 and 2, are due by January 15th, 2025. Then the local health department has 3 weeks to mail exclusion orders to families of children missing documentation of immunization or exemption. The letters will be mailed by February 5th. Then exclusion day is February 19th, 2025, this school year. This is the deadline by which all children must have up-to-date documentation of immunization or exemption on file with you, or by law, the children can't come to school or childcare until that documentation is received. Then you'll have a set of follow-up reports to do. The primary review summary, PRS, updated pages 2 and 3 and 4, due by March 3rd. Let's go over how to fill out these report forms. Page 1 has a top section where you fill out information about your school or childcare. The bottom section has boxes where you put the number of children in different categories. We're going to go over that bottom section and how to fill out those numbers. I'm going to do an example for you. So I have a childcare program where I'm going to say I have 60 children enrolled. That's the total enrollment. Of those, 4 of those are children who I am not counting for immunization reporting purposes now in my childcare. These 4 kids I do after-school care for. So the school is going to count those kids on their immunization report. So I don't need to count them on my immunization report. I'm going to subtract them out of my numbers to get my adjusted enrollment. Children not counted are children who attend your facility, but they're actually counted for their immunization reports somewhere else. So 60 in my total enrollment minus the 4 kids not counted equals 56 in the adjusted enrollment. Now, for each of those 56 kids, I need to categorize them into one of the 6 boxes below. To do this, you need to have gone through their immunization record and figured out who's complete or up to date, who has exemptions, and who's incomplete. If you need help doing that part, watch the trainings that we have about Alert IIS and about immunization records. Okay, in my example, I used Alert IIS, and I was able to figure out which kids are complete for vaccines, which kids are incomplete, and I know which ones I have exemption records for. Let's break down the numbers. Of my 56 kids in the adjusted enrollment, I know that 50 of them are complete or up to date on their immunizations. So I put that in the first box. I know I have paperwork on 2 children who have non-medical exemptions. I have 0 permanent medical exemptions and 0 temporary medical exemptions. And I have 3 kids who are incomplete on their vaccines. I also have 1 child for which I have no record. Okay, now let's check our math. Each of these numbers should add up to the adjusted enrollment. So 50 plus 2 plus 3 plus 1 equals 56. Great. Then for any of the numbers in the bottom 3 boxes on this page, I'm going to list those children on page 2 of the primary review summary. Here's what page 2 looks like. I'm going to list those kids who are in those bottom 3 boxes on from page 1 on this page here. So zooming in, I'm going to fill out the first 3 columns only right now. I'm going to list the child's name here, their grade and date of birth, and the parent's name and current mailing address. And also then, very important, remember when you turn in that page 1 with the numbers and this page with the kids who are incomplete or no record, make sure you attach photocopies of the Certificate of Immunization Status form, also known as the CIS, or in a printout from an approved computer system. This, all of this is due to the county health department by January 15th, 2025. And my recommendation is to turn in this page just a little bit early if you can, so it has time to get to the health department. And it's also nice for them to get the report before the due dates, as they're on a timeline to review all of the records and send out letters to any families that need them. Due January 15th. Then what happens in February after you've turned in these forms? Well, by February 5th, the county will mail exclusion orders to families of kids that are incomplete and you're missing the documentation of immunization or exemption for. And you'll get a copy of that exclusion letter as well. Then February 19th, 2025 is the annual exclusion day. You need to exclude any children if their records have not been updated as specified on that exclusion order. They need to be excluded until that record is updated and you have the paperwork on file. So if they don't have the paperwork to you by the next day, you still continue to exclude them. But you can let them back in as soon as you have that paperwork. So if an hour after the start of school on exclusion day, family shows up and they have the documents you need, that child can come right back in. After you get any updates needed from families, you can fill out your follow-up report. It's due by March 3rd, 2025, but you can turn it in anytime after you get all the updates from your kids. The health department will have filled out section C of that page 2 with yes or no, whether they had to mail an exclusion letter and the date and the vaccines that the exclusion letter was for. And then I use the last 2 columns here as a checklist. So you can keep track of all the kids who got exclusion letters and when you receive the documentation. So you'll fill out these last 2 columns. The date orders canceled, that's the date you get the update from the family with the information about immunization or exemption that was needed. Then you'll mark the last column, yes or no, whether you had to exclude the child on the exclusion day. Just those last 2 columns are going to be for the follow-up report, what you're filling out. You'll also fill in the primary review summary, pages 3 or 4, depending on what grades you have. And also those are due by the March 3rd deadline. Page 3 is if you have preschool, childcare, or Head Start kids, and page 4 is if you have any kids in grades K through 12. So to fill out this form, at the top, once again, you'll put in information about your school or childcare. And in the bottom sections, you'll fill in some numbers. So we'll go through an example of how to do those numbers now. So this form starts off with a list of questions that you'll go through and answer. The first question is, how many children younger than kindergarten were excluded on the exclusion day? It's important to fill out this number. If it's 0, make sure you write 0, because then the health department knows you had to exclude 0 kids and you didn't just forget to fill in that one box. Okay, question number 2, what is your total enrollment? Well, in my example, I have 60 kids in my program, and it's okay if this number has gone down since you turned in your first report. After all, you might have had a child that left your program. But if you have any new kids that started since the first report was due in January, don't include them on this section of this report. only include the kids who were already in attendance in January and were on your original report. Okay, so I still have 60 kids in my program. And I still have 4 kids who I do after school care for, and the school is going to count those, so I'm not going to count them here. Here's where the report gets different from the report that was due in January. This report has a question that asks, how many children are 18 months or younger? Well, I have 6 infants in my program who are 18 months or younger. And on this report, and this report only, I'm going to subtract these children out. So on this page, to find my adjusted enrollment, I take 60 kids in my total enrollment, minus 4 kids not counted, minus 6 kids who are 18 months or younger, and I get 50 as my adjusted enrollment. Okay, then it says, fill in the questions below for children in your adjusted enrollment. Okay, so I'm going to read through the questions. How many children have no record? So I got a record for the one child that previously had no record. So hopefully you've gotten records for everybody now, since this is done after the exclusion day. So I'm going to put 0 for no record now. The next question is, how many children have a medical exemption? I still have 0 children with a medical exemption. Then how many children have a non-medical exemption? I have 2 children with a non-medical exemption. And finally, number 9 says, how many non-medical exemptions are from the online module or a healthcare practitioner? Well, you need documentation either that the parent has watched the online module or that a healthcare practitioner has filled out the vaccine education certificate in order to claim a non-medical exemption. So you can look at your records and find out how many of your exemptions are from that online source versus the healthcare practitioner. And I looked at my records and I have 1 of each. Okay, let's move to the bottom section of this form. It says that for children in the adjusted enrollment, fill in the number of vaccines and exemptions. So I'm going to fill in on the left side columns the number of children with the vaccines. And on the right side, I'm going to fill in the number of children with non-medical exemptions. Okay, here's my trick for doing this part. I like to fill in the number of children with non-medical exemptions first. And this is because the number of exemptions is usually lower and it's easier for me to count. So I look at my non-medical exemptions that I have on file. 1 child has a non-medical exemption for all the vaccines. For that child, I count them in every single vaccine category: DTaP, polio, varicella, MMR, hepatitis B, hepatitis A, and Hib, and in the all category. The other child has a non-medical exemption only for the varicella vaccine. And so I'm going to count that child only in the varicella non-medical exemptions. I had the 1 child who had an exemption for all, plus the 1 child with an exemption for varicella. So that's why that varicella non-medical exemption number is 2. And now this makes it easier to fill in the numbers on the left side of the form. I know that I have 50 kids in my adjusted enrollment, and 1 child has an exemption for the DTaP vaccine. All the other 49 kids are now complete for their DTaP vaccine. Now, moving to polio, I'm going to look at polio, and I know I have same thing: 1 kid with an exemption for polio, and 1 kid who was exempt for all the vaccines, including polio. And all the other kids are complete for their polio vaccine. So that means I have 49 kids who are complete for polio. Now for varicella, I had the 2 children who both had exemptions for varicella vaccine, and those were the only 2 missing varicella vaccine. All the others are complete. So 50 minus the 2 exemptions is 48 who are complete for varicella vaccine. And I do that all the way down. If you have a kid who is behind on some of the vaccines, your numbers might be a little bit lower, but usually most of your kids by this time, when you're doing this report, will either have that exemption on file or will be complete or up to date for the vaccines in that category. And then finally, the last row is the all category. Well, I know I had 2 kids who are missing something because they have exemptions, and all my other kids have all their vaccines. So 50 minus the 2 exemptions equals 48 for the all category. If you have kindergarten, 7th grade, or any grades kindergarten through 12th grade, you're going to fill out page 4. The first set of columns on page 4 are for kindergarten, and the second set for 7th grade, and the third set is for all the kids in kindergarten through 12th grade. You would fill in these columns similarly to how we just filled out the previous page. If you only have a preschool or childcare or Head Start that doesn't include kindergarten or any other grades, then you don't need to fill out this page. The primary review summary updated page 2 and pages 3 and 4 are due to the health department by March 3rd. Okay, let's talk about some activities for late February or early March. So you're going to turn in that follow-up report, and remember, you can turn it in as soon as your kids are up to date on their paperwork. You don't have to wait until that March 3rd deadline. And I encourage you to get them done as soon as possible. And then you're done with the immunization review process for the year. Keep copies of your primary review summary reports and the exclusion orders for 1 year. And thank you so much for all of your hard work on the immunization review process. It's really important to make sure that kids have the opportunity to get up to date on their vaccines at least once a year so that kids can stay healthy and we have healthy and safe schools and childcare. So thank you so much for your hard work in this process. And just a note, if all of your kids are complete or have exemptions on file, you can turn in all of the reports all at once in January by that first deadline and be done for the year. Here's a reference and a website for the Oregon Immunization Law and Oregon Revised Statutes and Administrative Rules. Thank you for attending this training. For immunization report forms, you can find these at www.healthoregon.org/schoolpacket. If you have questions about immunization reports, you can contact your local health department or the Oregon Immunization Program School Team at oregon.imm@odhsoha.oregon.imm@odhsoha.oregon.gov.